This is Millie Mannion, certified legal nurse consultant, and I wanted to talk with you today about surgical cases, especially with retention issues. So I know you're involved in those cases. Tell us a little bit about your involvement.
Well, I've had an opportunity to work with both plaintiff and defense attorneys in regard to the retention of multiple of different surgical items. We know, of course, that the most popular one is sponges, but over the last few years we've really started to see much larger items and much smaller items.
Okay, so what are some of the most odd items, large and small, that you've seen?
Well, one of the largest items that we see a lot of is a malleable retractor that we use actually to hold the bowel in after abdominal surgery.
Okay.
And you know, the nurse will account for that during the initial instrument count, but then sometimes something will distract them. They won't get it handed back to them from the surgeon, and it gets retained.
Because that's always the question, how does that happen? And how does it happen?
It really does happen, Vicki, exactly the way it sounds. We account for it by saying one retractor up, and then we count the rest of the retractors in the kit. But then something happens. You know, the phone rings or the beeper goes off.
Right.
And we get distracted, and the surgeon isn't going to necessarily either catch on it, or he's letting the resident close, and it just gets left behind.
So I think you're bringing up a good point, because for sure it's going to be more of a nursing issue than a medical issue in many instances, right?
It
So the
certainly
nurses
is.
are going to definitely be held accountable in a retention case.
Oh, absolutely. All of the policies and procedures that are now being written by most of the hospitals with the AORN guidelines and recommendations are including nursing as definitely part of any type of litigation.
Okay, so if you're on the plaintiff side, how do you prove these cases?
Well, from the plaintiff point of view, I would first sit with the attorney, walk through a timeline of what is the appropriate way in which the count should have taken place, talk a little bit about what kind of surgery was actually being done, so that he has a clear picture as well, how did that get left in the belly or in the head. And so we would work through that. We would name some of the players, you know, definitely the circulating nurse and the scrub nurse, the surgeon, and even now some hospitals are accounting for bringing in the anesthesiologist.
Sure, yeah, absolutely. And even though I'm sure these can be difficult cases to defend, you said you've been on the defense side, what do you do to help mitigate damages, or at least to help, defend the case to the level that you can?
Well, on the defense side, it would be my job to try to help them see that who exactly was the last person to touch the object.
Okay.
And where did the object actually fall within the operation, which is usually the biggest part of trying to figure out the puzzle, is when was that item used last?
Right. So that's an important point. It's not just a matter of slam dunk, it was left in, everybody knows that, but more a matter of who's really responsible.
Absolutely. And also when you're working with the defense attorney, what I try to do is try to help them to understand that, okay, we need to look at how did we get the object out? Was there harm to the patient when we took the object out? And sometimes you can really work with the amount that the person, wants as compared to the amount of the money the hospital wants to pay, based on exactly what did we have to do in which to retrieve it.
Right. Plus, I'm sure you can help with true injuries, like how serious are the injuries really, or is the plaintiff potentially alleging more exaggerated injuries than they've got?
Absolutely, and I think that is really where, from a defense point of view, we really want to have a certified legal nurse consultant like myself who has a lot of OR experience, so that I can say, well, there's really not any way that that particular retained item could have actually caused that problem.
Right. And the other thing I'm so glad you brought up, the OR is such a mysterious place to the rest of us who have never worked in the OR.
It is.
That again, on the surface, the retention of a surgical object can seem kind of like a slam dunk case, but as you're pointing out, there are subtleties for how to prepare these cases. So a certified legal nurse consultant who's never worked in the OR should be looking to subcontract with people like you.
I would appreciate that, absolutely. But also I feel like from an education point of view, I'd like to help other people to have an understanding. You know, I want our other CLNCs to be able to look at the medical records to get a feel for what exactly went on in the operating room. And then, you know, give me a call so we can have a nice educated conversation.
Yeah, and to really look at it in such an in-depth way that the attorney gets why they really need you.
Absolutely.
All right.
I really agree.
Thanks, Millie. I really appreciate you taking the time today.